what cells, like where has it been doing the most damage? Because there's so many questions about like, why does it kill some people so quickly and others seem to just have mild symptoms?
What is known about this virus is that it binds through what's called the ACE2 receptor, which is a receptor that it's like, you could think about it like a lock and key. The virus is the key and the receptor is the lock. And if the key fits the lock, the virus is able to enter the cell, and then it's able to produce more copies of itself and then expand and destroy tissues in the body and to basically cause havoc and wreak havoc in the body. For instance, lung cells in your respiratory tract express high levels of ACE2, which is why this virus really propagates and builds up its numbers in the respiratory tract of patients that get it. Now, as far as your question about why some patients don't get it as bad as others, there's lots of explanations for that, but nobody knows for sure. One explanation could be that there are different levels of that receptor on the lung cells of those particular patients. Maybe older patients who seem to be more susceptible have higher levels of expression of that particular receptor, but we don't know that right now. But that's one possible explanation. Another possible explanation is that if they have a precondition, such as they are smokers or they have heart disease or other components, that affects your immune system, which is how your body fights off bacteria and viruses, to the point where they're somewhat depressed in their level of being able to control any viral or bacterial infection. So this virus takes hold, and then it's able to cause different levels of infection in different people.
Do you think that people can develop an immunity to this?
Immune responses is how your body fights off a bacteria or a virus. And the amount of immune responses you make or I make would be different depending on how we see the virus. And it really depends on how much the virus infects us. For the most part, with most viruses, if a person becomes infected with that virus and gets relatively sick or very sick from that virus, your immune response is very stimulated to that particular virus, and it makes a very strong immune response, which eventually clears that virus, which means that person or people would hopefully have long-lasting immunity. If they came into contact with that virus again, they would most likely see it, recognize it, and destroy it almost immediately. The problem, or there is a case where people who are asymptomatic or don't develop a huge immune response to this virus, if they get the virus again, one would argue that they fought it off the first time, they should be able to fight it off again. But what if they have something else that has come into their system in between that lowers their immune status? That's why developing vaccines where you actually vaccinate someone to allow them to see the virus in a non-infectious state, maybe giving multiple boosts of that vaccine, would allow someone to be able to control that virus when they saw it the next time.
With the lab's work right now, besides testing and developing the animal model, are you all working also on, say, therapeutics?
We are. So we've developed multiple tests. So I like to break it up into a couple parts. It's much easier to think about it that way. The first test that we've helped develop is a new assay to be able to determine how much virus a person has. So right now there's a CDC approved assay, which we are currently running, but we're also developing new assays that may be able to be more sensitive and be able to detect lower amount of viral infection, because maybe those asymptomatic people have a very low amount of virus, which is why they're asymptomatic, and you can't really tell, they don't even become positive. The second one is, it would be really nice if we had an assay or a test that would allow us to say, you know what, Tara, you were sick and you thought you had COVID, you're not sure you did, maybe you were asymptomatic. Is your body able to respond to COVID-19 if you were to see it again? As in, do you have the antibodies to actually control that virus the next time? So we're actually developing and have developed an assay or a test that will allow us to test whether you or I have actually seen that virus before. So that's really important for us to hopefully get back to a new sense of normal in the country and across the world. The third assay or test that we've developed is we've developed a high throughput screening, basically looking at whether small molecules, drugs, repurposed drugs like hydrochloroquine or chloroquine or remdesivir actually have an effect on the virus if you put it in a tissue culture.
You know, that the main question for a lot of people is, at what point will it be safe to kind of get back into whatever this new normal will be? That can they go back to their office buildings? Can they, buy food from a restaurant like they used to do?
Right. So as far as timeframes, that's a very difficult question to answer, although I will try. Scientists around the world, including researchers at our institute, are trying to develop the tests that will allow us to determine, is someone infected? Is someone not infected, to a very sensitive degree? And then if you've seen the virus, we would argue that you would have that response, an antibody response, so therefore you would be protected in the future. As far as how long it's going to take to get there, we will get to a phase hopefully by this summer, maybe June or July. I was telling my wife the other day that I was hoping maybe on the 4th of July, I'll be able to have my father and her parents over to our house for a 4th of July picnic, because I'm hoping that maybe we'll be in a situation where we can start to relax some of those. But we have to be really careful when we do relax those restrictions, because we don't want that virus to come back out and actually be more of a problem later on.
So what would that treatment look like? Would it look like a cough syrup? Would it be a shot? What is it they would see?
Ideally, what we would hope for in the long run is something that is orally administered. So you could literally just take a pill once a day or once a week, and it would allow you to fight that virus off, to allow your immune system to come on strong. In the meantime, for right now, a lot of what is being looked at is mostly through an IV administration, which for people who are in the hospitals is really an option. For people who are outside of the hospital, it's obviously much harder, and they would obviously prefer an oral administration.
And that's where that third line of effort of testing the drugs like the chloroquine,
Yes.
So are you guys actively testing that drug right now?
So we are testing hundreds of drugs right now, and that is one of the drugs we are testing in our high throughput system. We're testing derivatives of that particular drug as well as that drug itself.
Have you, just in the controlled environments, been able to manipulate and see what the virus likes or doesn't like, lives longer under warmer temperatures in the lab?
Viruses have actually adapted to survive at 98.6 degrees. Do you want to take a guess at why that is?
Because of us.
That's exactly right, because we are their vehicle. We are their means for production. So if you lower that temperature or increase that temperature, the virus is less able to replicate. So one thing people don't really know is when you get a fever, the fever is not necessarily the virus itself causing your body temperature to rise. It's your immune response creating a higher body temperature because the virus doesn't survive as well at that temperature.
How easy might a test be for people?
The way I could envision the testing for antibodies is you would go into a CVS or a drugstore, and they would actually take a pinprick of blood, just like you were doing like an insulin test or something. And basically they would take that blood from a pinprick and place it on a piece of paper, and basically in 5 to 10 minutes you would be able to tell whether your blood has the antibodies that are specific for that particular virus.
Do you think that there's any chance at all that this was a man-made virus that was meant as a bioweapon, or is this so closely related to some of the other viruses this lab has handled that it's just the latest iteration of this COVID?
So at this point in time, I don't know exactly I don't believe that this was a man-made virus. There's been lots of events like this throughout human history where viruses have spilled over from an animal where it lives very well with that animal and doesn't cause any sort of sickness or illness, and then it spills over into humans and it causes sickness. As we continue to industrialize different parts of the world that are not industrialized from before, we're encroaching on new environments. We're disrupting ecosystems that we have never touched before, so therefore that opportunity becomes much greater. So maybe the reason why we're seeing this more often is because we now have moved into areas we haven't seen before.